We're back with Dr. John Link for Breastlink. Now, Dr. Link, you have this book, The Breast Cancer Survival Manual, in its 5th edition. Why did you feel that you needed to put out another edition? What's new?
Well, it's a book for a woman who's newly diagnosed, and it's a crisis manual, and it's an instructional manual how she can get the best possible chance at cure. And the truth is that there's tremendous change and evolution in our treatment. So every two years or so, I've needed to update the book just because of the changes in treatment.
Something's big and it's like, okay, now it's time to get to writing again.
Yes.
Well, so when a woman does find out that she has breast cancer, is that something, does she need to make all the decisions she needs to do as far as her path? Does she need to make those decisions immediately? Does she have time?
No, she's got time. And that's one of the things I say right away is that there's time. One does not need to be pressured or rush into treatment that she might be sorry that she did. There's time to get a second opinion if that's needed. But there's this panic. I mean, women feel panic when they're diagnosed. They want the cancer out immediately, and they want to be cured, and they don't want to think about it. But it's much better to relax, take deep breaths, really have everything reviewed, see experts, come to a center like ours, not necessarily ours, but a place like what we do, where doctors work in concert, review things, and then a treatment plan is developed. And things have really changed. In the old days, it was surgery always first, oftentimes radical surgery. Now we do much less surgery. Sometimes we do medicines first before we do surgery. It really depends, because cancer is a very, what we call heterogeneous disease. It's just not a single disease.
So do all patients, so what you're saying is when they come in, all women don't go through the same path in fighting breast cancer?
No, it's very different. And what we know now in the last few years that there's a new classification of breast cancer. There are 4 basic types, and then there are many subtypes of those 4 types. And we treat them very differently, sometimes from a surgical point of view, sometimes from a medical point of view, as far as hormonal therapy, chemotherapy. So it's pretty complex.
Okay. Now, you had talked about second opinions. I think that might be hard for some patients. You know, if they like their doctor, will they feel like they're insulting their doctor by getting a second opinion? How important are second opinions?
You know, it's part of medicine today, and most doctors are not offended at all. In fact, encourage it, because once treatment starts, you want a patient that's partnering with you, that feels confident in what you're going to do. And so if that requires a second opinion, that's great. You know, it's important that for the woman, and frankly, the woman needs to put herself, her health, and herself ahead of offending a doctor.
And a good doctor knows that.
Yes.
Okay. Well, you know, a number of women are, you know, with kind of the whole foods craze, are seeing chemotherapy as a toxin, which it is, but, you know, they're like, why would I want to put a toxin in my body? And they're seeking alternative therapies. Is that something you suggest, looking into alternative therapies?
I tend to call them complementary therapies rather than alternative. We're using much less chemotherapy, cell poisons, than we used to. It's down about 50%, because we can now identify those cancers that are fast growing, that really need that kind of chemotherapy treatment. So we're using much less, but we know complementary therapy, even given with chemotherapy, helps women tolerate it better, have less side effects. Complementary therapy is important.
Now, should all women get screened for breast cancer, and when should they start?
Screening should begin, I believe, for all women at 40, and the different medical societies differ between 40 and 50. But breast cancer, for the most part, is a disease of aging women. And breast cancer under 40 happens, but it's rarer, and it just probably doesn't make sense to do X-ray mammographic screening under 40. But once a woman turns 40, she should have a screen every year. And later on, I think Dr. Chen, our mammographer, will go into this in much more detail.
Okay. Well, let's just talk a little bit about clinical trials. I know, with a lot of health maintenance organizations, HMOs, they might not be able to get into clinical trials. But is that a good or bad thing? I mean, should people be using medication that has been, tested and analyzed versus, kind of feeling like a guinea pig? What do you feel about clinical trials?
The cure rate of breast cancer is very close to 90% now. And one of the major reasons that it is because of clinical trials. We would not be where we are if women hadn't volunteered to do this. Early on, 30 years ago, clinical trials involved a new treatment versus placebo, meaning a non-treatment or no treatment. That's not the case anymore. Women that go on clinical trials get absolutely the state of the art, and then we're testing something, an add-on, something a little bit new to that. So, and then comparing the state of the art with this little add-on allows us to tell if this new therapy works or not. So, most women can have access to clinical trials, and it's something I go into in great detail in the book.
Well, I really enjoyed your book, even though I don't have breast cancer, my mother did, and I feel like this is a book that you would want to hand to, someone newly diagnosed, because you really handhold people through this. So we thank you. You can get more information at breastlink.com.
Well, we're going to keep taking care of women with newly diagnosed breast cancer. We update the book on our website all the time, new research trials, and then in about 18 months or so, I'll be ready to write another edition, I think.
You don't slow down, do you?
No.
Well, women all over appreciate your help. For more information, you can visit breastlink.com and join us back at Every Way Woman.